Our next speaker would be Dr. Anam Zara. She would talk about workplace challenges. Please, Dr. Anam Zara.
Hi everybody and welcome. My name is Anam Zara. I am the psychiatry BST trainee working in Cork and Kerry Mental Health Services. First of all, it's a very great opportunity for everybody who are here and for all the new doctors. Thank you so much, Her Highness, and also our President. Association of Irish Pakistani Surgeons and Physicians is actually kind of a family platform where they encourage all the new doctors who come, they can come and ask questions that how they can progress. As just now Dr. Javed have mentioned that whatever you want to do, you should be specific in your goal, and obviously you can get all the information and guidance from our seniors here. This is how I got my guidance for getting into the training, and the topic that I'm going to discuss today is workplace-based challenges. So first of all, the system, healthcare system is actually very different in Pakistan, and when you come here, it's kind of a initially icebreaker kind of a thing because you don't know how different things work here. The most important thing is communication and privacy. Communication with your senior colleagues and with your team. Particularly, I would say that it's very important to communicate everything with your consultant. Second thing is the privacy of the patient, which is very, very important. So there are various situations. First, when you see a patient, there can be different areas that the patient asks you different kind of questions. First, it should be based on the patient. Like for us as immigrants, it's very common that the patient asks about our background. It's okay, we can tell them about our background. We come from this kind of country. But I always remain focused and redirect patients that it's about you. I'm here to see you, not to tell you about myself. So privacy about yourself and privacy about the patient is very important. Second thing, in Pakistan, when we were working, if there's an injury or anything like that, we do take picture of the patient's injury and share via WhatsApp or different media to our seniors to ask for advice or anything. This is not a good practice here. And this thing can lead you into very serious trouble. So just to avoid these kind of things, even if you are going to get some kind of collateral history or collateral information from your patient's family, you have to ask for a consent from the patient. If the patient says no, then it's a no. So you can't break down the confidentiality of the patient or the consent, except in very serious situations where your consultant would have told you to do it like that. Second thing is that handling difficult patients or difficult kind of challenging situations. That can be with a patient, or that can also be with your colleague, can be with another consultant. But for handling these kind of situations, it's very important to ask your consultant for supervision. I remember when I was not in training, in first few months when I came here, I was a non-consultant hospital doctor. I still asked my consultants to give me at least 1 or every 2 weekly supervision. And what does supervision means? I think the concept of supervision is nothing in Pakistan because we never had that kind of extra support from our seniors in Pakistan. But here we do have. And that actually really means that it is support. It's not only support. So ask your consultants for your supervision, and in that supervision you can discuss about different challenging encounters. It can be with the patient, like some unfortunately there are very less, but some patients there can be very rude. So and obviously it's very natural when you come from and you are new here, you come from Pakistan and you are alone, all alone by yourself. It can lead to an emotional turmoil. So just to avoid these kind of situations, it's very important that you ask your consultant and discuss the things with them. The other thing is that poor work-life balance. we feel like when we came here, we are only for work because we don't have a family here or there are no other things to do. But there is a lot to do. First, it's very important, and it depends on you to how to manage your work-life balance. I even try to post this as my learning outcome goal in my training, that I have to manage my workplace balance. And this is the thing that my consultants really appreciate, that you know that what are your goals. This is where your area of work is, and this is where your own life and your personal life comes, and how you are managing that bridge. Because the people who are working in A&E, in psychiatry particularly, in different specialties, when they are on the on-call rotas, it becomes very difficult for them to unwind the workplace based kind of pressures. So that is very important. And the last thing is that job burnout. So initially when we come to Ireland, we are given the contract for 6 months, and we think that after 6 months it will be automatically renewed or things will happen. But it doesn't happen like that. So it's very important that you, within those 6 months, you build that kind of repute with your consultants and your clinical directors, and before even near to the end of your contract, start communicating with them that what's going on, what they think about your next contract. Because, and if in case you are burnout in that particular job and you want to switch to another department or into another hospital, or everybody has kind of links, you can get an advice from them. You can always, I feel like yourself and your consultant should be a mirror image. So you should always tell them that these are the challenges and this is what you are thinking. The last thing that I will talk about is the sick leave. I don't know anybody have covered that or not. In Pakistan, we were because there's no sick leave concept. Initially, when we come here, like it happened to me, it happened to few of my colleagues, and we discussed that when we were sick, we used to go to work because we were very guilty to ask for a sick leave. But it's not like that here. So if you are not able to work, ask for a sick leave, and in our contract it's included. We have the right to ask for a sick leave. If you will take care of yourself, only then you will be able to take care of your patients. So ask for your rights, know what are your rights, and then proceed ahead and be a goal-directed kind of a person. Okay? Thank you.
Thank you so much. I would just like to add one thing. I think she already mentioned, but just my own words. Never forget 4 alphabets, which is GDPR. So even when you're sleeping, it should be in the mind, GDPR. No patient's information can never be disclosed to anyone else who is in the chain of treatment. In UK, there have been incidents where the husband opened the medical records of their own spouse, and they were like haunted by GMC about that you are not in the chain of the treatment, why you have opened this medical records. So it is very important. The rest, I think everything has been covered.